there was a study, of course, that came out that said overwhelmingly most COVID patients, overwhelmingly most patients who are infected, it says that they do have some sort of a vitamin D deficiency. Overwhelmingly, as you can see, 80%, which is quite a lot of them. And so it's important to understand, if you know someone that has this infection and you're following up with your family members who are in the hospital, you'd want to ask, is the person receiving some sort of replenishment because of the lack of vitamin D? Overwhelmingly, many of these patients are missing vitamin D. Again, this is coming from the Journal of Endocrine Society's Journal of Clinical and Endocrinology and Metabolism. And this came out back in October of 2020. I'll leave the link in the description for those who are interested. And I thought this was another tidbit because I kind of joke about this at the hospital, that I'm basically immune because I read types of articles like this way back, which I'm sure many of you have never heard of, that individuals who are type O have been linked to having much lower levels of, one, even becoming infected, and two, experiencing a severe reaction related to the disease. And while it does make this point here about taking vitamin D unlikely to help, it's important. It's referring to late stage. So it goes on to say, I believe it's right there. Here, low levels of vitamin D have been linked to higher risk for severe C19, right? Like I said before, article here talking about 80% of these individuals have low levels of vitamin D. And of course, as a result, many of these are experiencing higher levels of severe infection. But it goes on to say, but high levels of vitamin D do not fix the problem. Increasing vitamin D levels in critically ill did not shorten their hospital stay, right? So these are basically what we would call end stage, where the virus has basically ravaged their bodies and there's basically no coming back. But again, in early stages, of course, it does show a lot of promise because vitamin D, of course, is necessary for help, especially when it comes to fighting off respiratory illnesses. And it's important to ask, if you know someone who's in the hospital, or if you have any family members who are in the hospital, you would want to ask, is their vitamin D levels low? And if they are they receiving some sort of a replenishment? That's basically going to be it. Thought this was some information that people might find interesting in terms of what is going on with the virus. I'm always interested in stuff like this because I do like doing research myself. Been a nurse for quite some time, and of course, as nurses, we are responsible for educating the public, but also when it comes to information that perhaps is not being pushed as much as it should be, well, then I try to do my best to try to find all of the information that I find personally interesting, and of course that is educational to the public.